coverage you can count on. Way 31 News starts now. This is breaking news.
I'm Way 31 News anchor Will Robinson-Smith. We're interrupting local programming right now with a breaking news update on the coronavirus. Huntsville and Madison County officials are about to give their daily update on how they're dealing with the virus. Let's listen into what they have to say.
On our community response on COVID-19. Our speakers today will be David Spillers from Huntsville Hospital, Dale Strong, Madison County Commission Chairman, and Karen Shepard, Director of Animal Services, City of Huntsville. Again, you will note that we are sitting at least 6 feet apart, abiding by the CDC guidelines and our own best practices to sanitize and separate. At this point, I'll give you a brief update on where we are currently at with this situation. Currently, there are 647 confirmed cases statewide. 61 of those currently reside in Madison County, resulting in 1 death in Madison County. Again, we continue to monitor the situation and respond accordingly. And with that said, I'll turn it over to Mr. Spillers from Huntsville Hospital.
Good morning. Let me start by telling you that we are continuing to prepare for the possibility that we might have a significant number of inpatients with COVID-19. We've been able to identify hundreds of available beds if needed. Those are not ICU beds, but they are beds if needed. I, like everyone else in the community, hope we don't need them, but our job is to prepare for what might happen. Need to remind you that COVID-19 patients consume an enormous amount of resources. I probably use 10 times as much resource as a regular patient, so about every 10 COVID patients would be the equivalent of 100 normal patients. They also stay in a hospital generally 10 to 12 days, so that's why hospitals can fill up very quickly when we start having inpatients that had COVID-19. I also need to let you know that everything else that we take care of is still coming in the hospital. We've eliminated elective procedures, but today we have over 550 patients that are in our Madison County hospitals. We have 5 that are COVID-19 patients. So we're continuing to care for people who have heart attacks, strokes, cancer patients, trauma patients, other patients that need hospital care. Our team's doing a phenomenal job taking care of that while continuing to prepare for what might happen with the COVID-19 patients. And I do want to commend our staff. The morale is great. People are stepping up as they always do in a disaster like this, and it's impressive to be a part of a team that's doing what they're doing. I was thinking last night, Huntsville Hospital's been here for 125 years. We have never closed our doors in 125 years. My guess is the only thing that could have had the magnitude that this could potentially have was the 1918 flu. And if you want to see the potential of what could happen if we don't control this, go back and research the 1918 flu. That's why people need to look at that and realize how fast something like this can get out of hand. But I say the potential because we as a community can keep this from happening. If we will distance ourselves from others, wash our hands, and sanitize, we will be able to minimize the number of people that get this. And if we minimize the number of people that get this, we will minimize the number of people that need hospital care. So you need to help us as healthcare professionals by trying to keep people from getting COVID-19. Please do your part. I saw people walking this morning when I was coming here, and they weren't 6 feet apart. And everybody needs to stay 6 feet apart. Even family members need to separate. It benefits us all if you separate from other people and you sanitize your hands. Fewer and fewer people will get this. We've probably tested well over 3,000 people in North Alabama. As mentioned, we've got 61, I believe, identified cases in North Alabama. Our testing numbers may look a little different from the state if you look at the state website that has the number of people tested, We use a different lab than the state uses. I know for sure all of our positive cases are reported to the state lab. I'm not sure all the negative cases are being reported as quickly as they could be. So if you look at that, we are, the number of people who are being tested positive is really a small percentage of the people we're testing, and that's a good thing. Well, I have gotten some calls from people who were tested in our flu clinic when we first opened it up that still don't have their results. I apologize for that. We opened that clinic using one of the 2 large national labs that the federal government had designated as the labs that had testing equipment. Those labs have been unable to turn the results around very quickly. After, I think, the second day, we switched to a lab in Birmingham, and now those results are coming back within 2 days usually. If you were one of the first patients to go to our flu and fever clinic and you still don't have lab results, you've got 2 options. If you're feeling well, just continue to wait on the lab. If you feel like you need to be tested again, come back to the flu and fever clinic on Monday and let them know that you were there and you never got your test results, and we'll help you get another test. I apologize for that. There's a flaw in the system, I believe, is how testing kits were distributed. Large hospitals like ours have the ability to test in our lab and get immediate results, but we cannot get access to the material to do testing. And I think it's a travesty that the busiest hospital, we see more patients in an inpatient setting every year than any other hospital in the state of Alabama. And we can't get testing equipment because they've designated these large national labs as the place to get testing equipment. The priority really should be inpatients and places like Huntsville and UAB, but that was not what the early decision was, and that's caused us some testing problems. In addition to that, we're not going to be able to run our John Hunt Park drive-up clinic on Monday because we don't have enough testing supplies for that clinic on Monday. We hope to have more by Tuesday. As soon as we get enough testing supplies, we'll open that clinic back up. We've been seeing 200 to 300 people a day in that drive-up clinic. We will not open it Monday. We will open our flu and fever clinic on Governor's Drive. So if you need to be tested, try to go there. Knowing John Hunt Park's going to be closed, you can anticipate that there will be a backup of people trying to get into the flu and fever clinic. We are going to run our mobile medical unit in North Huntsville. We have a church set up to go to in North Huntsville to do testing there, and we will continue to do that as long as we have available supplies. We hope that this is temporary and that the people that are supplying us lab testing equipment, kits, will be able to get us more later this week so we can open up our clinics. You hear a lot on TV about supplies and where we stand with equipment. As of today, our supplies are in good shape. As we look out 2 weeks, based upon the current patients we're treating, we're in good shape. As I mentioned, if the volume of inpatient goes up, that's when you start straining the supply chain. If a COVID patient, as I mentioned earlier, consumes 10 times the resources of a normal patient, you can see how that could quickly overwhelm your supply chain and lead to shortages. We're doing everything we can to predict how much supplies we will need and acquire those either through our normal distribution channels or going directly to China or trying some unique and unusual things to get supplies. But every other hospital in America is doing the same thing. So whether we'll continue to be successful. We have been successful to some point, to some degree, but whether we can continue to be successful, that to be determined. I'll close by saying once again, how this impacts our community in North Alabama really depends upon how the people in North Alabama respond to the request to separate and sanitize. If we do what people are asking, we will be much better off than other parts of the country. We've seen positive tests. I wouldn't be surprised if we see more positive tests because we're testing so many people. But we have the ability to slow down the number of people who are converting positive if we will separate and sanitize. Thank you.
Thank you, Mr. Spillers. Now we'll go to Commission Chairman Dale Strong.
Thank you, Jeff. I'll say that our daily conferences are very informational. I know that a lot of folks are on these calls, and I want the people to know who is on these calls. This morning, our daily conference call with Alabama Department of Public Health. You had the presidents of Huntsville Hospital, Crestwood Hospital, the director of emergency management. You had the CEO of Huntsville Emergency Medical Services Incorporated. You had the president of the Chamber of Commerce. You had Redstone Arsenal, the Madison County Commission, Huntsville Mayor Tommy Battle, Madison Mayor Paul Finley, and others that were on this call. If you look today in Alabama, as of 5 minutes ago, 647 positive cases for the coronavirus in Alabama. You had 61 cases that have tested positive in Madison County. The big note that was made by the Alabama Department of Public Health is that the greatest increase of positive cases are occurring in Madison, Limestone, Jackson, and Morgan. This is reason to be sure that people continue to sanitize and separate. This is how we decrease that number. You look at it yesterday, Huntsville Emergency Medical Services Incorporated was dispatched on 180 calls. Of that 180, 130 were transported to local hospitals. And of that 130 that was transported, 22%, the paramedics had to put on personal protective equipment because of signs and symptoms that were there. You look at Redstone Arsenal, less than 30% of the workforce was there on Friday, and if you look at the Marshall Space Flight Center, we're anticipating less than 650 on Monday. This is my third COVID-19 daily update conference representing local government. And in the last 13 days since this briefing began, we've continued to bear witness to both an unprecedented and historic time, not only in our local community, but in our nation's history. The next 14 days are critical. We stress again, sanitize and separate. When we began to monitor and assess and plan for today's situation, my focus began with one sole mission, and that was to protect the health and safety of the 370,000 residents of Madison County, along with our county workforce. Our local leaders, the Alabama Department of Public Health, Huntsville, Madison County Emergency Management, Redstone Arsenal, Huntsville Hospital, Crestwood Medical Center, HIMSI, the Chamber of Commerce, Mayor Battle, Mayor Finley, continue to talk each and every day to evaluate and when its needs are to alter our plan, that is exactly what we do. I could talk about the number of COVID-19 cases in Madison County or the entire state of Alabama, but what is most critical is our mission now is to all do our part to prevent further contagious virus spreading it. So what we've got to do is everybody's got to do their part. A few days ago at a press conference, I shared that our approach to social distancing was working to mitigate the spread of this virus. But as we've seen, the cases numbers steadily rise day after day. Today we know more than we knew yesterday. And of course, this right here is what we're trying to do, is to protect the people of Madison County. Friends, if you stay home, that's what we're asking you to do. If you get out and enjoy some fresh air in your patio area, on your own property, walking in your neighborhood, but please heed the advice of health experts who implore people to stay home, because we know that social distancing is the minimum of our responsibility to avoid potential exposure to ourselves and others. Madison County continues to conduct vital operations of business to our residents, the Sheriff's Department, sanitation, water, public works, human resources, finance, legal, license department, tax collector, tax assessor, and we're serving our community the best we can under these circumstances online. If there are services of Madison County residents need, they can be found online at madisoncountyal.gov. And if you need my help, you can call my office at area code 256-532-3795 at any time. We've gotten a lot of calls this week, and we've provided some good information, but the big thing it comes down to is sanitize and protect your family. Stay 6 feet away, and I believe that in the next 14 days we will see positive results of this. I want to thank all of those that are involved. I want to thank everyone that's listening today to spread that information. I want to thank our churches and our synagogues that have taken action to inform their people of what is best. Also, I know that the mayor, myself, have received an enormous amount of calls related to that, and I believe that most are heeding that information. Again, it's an honor to serve as your chairman of the Madison County Commission.
Thank you, Chairman Strong. At this time, we'll go to Dr. Karen Shepard, Director of Animal Services for the City of Huntsville.
So we are doing very well at Huntsville Animal Services. It was the recommendation from the national organizations to go to an emergency-only basis. And normally we have a census of close to 100 pets, and right now our census is 14 pets. So we are working very hard to make sure the pets and people that need our assistance and help are receiving that, but are receiving it in an incredibly safe way where we sanitize and separate. And in all situations, what we're trying to do is shelter at home, which means that if you find a lost pet, we want you to call us, and we can email and call, and we can resolve that issue with you, most likely through social media. At that time, if needed, if the pet does need to come into the shelter, we can make sure we do it in the safest way possible. So the 14 pets that are there at the building right now, we will be looking for them to get adopted or fostered, but we're trying to reduce the number of people that come into the building. We are open, but our doors are locked. And each time someone comes, we're asking them to have a purpose, and we're actually meeting them outside, making sure they're comfortable with social distancing and understand. And if they have a purpose, we're able to resolve that. A lot of people, and we love this every other day of the year, people come and visit us and spend time with the pets, but we're asking people, we can't do that right now. If you're coming to foster or to adopt, we'll get the pet, bring it outside and work with you. But just to view, we're discouraging that. We're also discouraging small children because they don't understand social distancing. So things are going beautifully. The community is very in tune with shelter pets, not just here in Huntsville, but all across the United States. And shelters that have never experienced having very few pets in the building are experiencing that right now, because the national guidelines are to keep the pets out of the building, still provide resources if needed, and all the pets that are in the building to get them into foster or adoptive homes. So it's really been a bit of a silver lining. And we're having conference calls 2-3 days a week with national groups, just a lot of positive of how we're functioning during this crisis, and learning and hoping to keep going forward with these methods to keep pets from having to come into the shelter. And it's a stressful situation for the pets. So 14 pets, it's a pretty exciting time. You can find our pets online at www.huntsvilleal.gov/animal, and then you can find the pets that are available for adoption. You can also see all the pets that are lost and found. I'm sure those things are available in your community if it's not local. And if you do have the resources to foster or adopt, I'd recommend you look online for pets and then reach out to us by our phone number or one of our emails. And the best phone number for us is 256-883-3783. We will answer your questions, whether you have a lost pet, whether you need to surrender a pet, or if you're interested in adopting fostering a pet. We're going to help you on the phone or by email, and then we'll arrange an appointment for you to come and visit.
Thank you, Dr. Shepard. Thank you for watching today. We will be back here again Monday, March 30th at noon with another daily briefing. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Stay safe, stay separate, and remember to sanitize. At this point, we'll open it up for questions. We do ask that when you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Good morning. My name is Dallas Parker with WH&T. My questions are for Mr. Spillers. You mentioned a flaw in the system. How many tests are outstanding right now, and how many people are stuck in limbo?
I can't give you the exact numbers of how many have not been returned. I'll see if we can gather that information before we get back together Monday and let you know.
Gotcha. Now, in terms of the testing supply shortage, what are you all doing to obtain the necessary supplies, and what are the supplies you guys are limited on?
Yeah, so the supplies that we're limited on right now are test kits to test people for the flu, the ones that we use at John Hunt Park. We use a supplier out of Birmingham for that, and as people have increased drive-up testing throughout the state, they've run out of the testing equipment. They assure us they're working with their suppliers to get test kits so that we could then continue to do the testing. Other than that, right now we don't have any shortages. If we look down the line, we're looking at some potential supply shortages if we get a lot of inpatients, maybe a few pharmaceuticals that we're concerned about. So we're already trying to find alternatives to those so we can stock up on. We want to stock, but we don't want to hoard, right? It's a delicate balance. You don't want to take supplies away from places like Birmingham and New Orleans where they've got to have them right now, but you want to have adequate supply for our community when the time comes.
I'm Casey Albritton with Way 31 News. My question is, you guys mentioned that you have just received some more beds. Could you elaborate how many and where you're getting them from?
Yeah, we haven't. So we've identified beds within our hospital that could be used if they were needed for patients. We have, in eliminating our elective procedures and really cutting our surgeries probably in half of what we normally would, we free up all of those beds. We free up the pre-op space for those patients, the post-operative space for those patients. We've also got areas in our hospital. Our cardiology department has about 35 cardiac short-stay rooms that we actually built last year, and those are all equipped for a patient to sleep in if needed. We're looking at the day beds. We have beds where people just stay 24 hours. Again, all of those could be used in a pinch. And then we've got about several hundred mattresses that we had in the warehouse and beds that we could bring in and put in different areas of the hospital. If my guess today is we probably have or could create 500 additional beds over and above the 550 or so that are occupied today, possibly more than that. At some point, beds aren't the limiting factor. Supplies and staff are the limiting factor. And that's the other thing we're trying to work on, is how do we staff all these additional beds if we ever need them. We've talked to places like the Surgery Center, which is a partner of ours that's not open. They've got a lot of clinicians. We could get them to come in. We could get physician offices that scale back to come in. But keep in mind, most of these people have not been doing inpatient care. So we would have to figure out how to partner them with people who have been doing inpatient care, make sure that somebody's there that can understand the computer systems, that can order drugs and do all the things that have to happen. You don't just put somebody in a bed. You got to care for somebody you put in a bed. So there's a lot more to it than just creating bed space. We have not looked substantially outside of our hospital yet. Other communities are looking at hotels and facilities like that and how they would use them. We started that late last week once we had identified the number of beds that we had in our hospital. And I might also add, we've got additional bed capacity. One of the great things about being a system in a situation like this is we got 11 hospitals across North Alabama. So we do have the ability to potentially shift some of those lower acuity patients that are in our beds to some of our outlying hospitals that have bed capacity. We've already set that, we've already discussed that, and we have a plan for that. So we'll distribute as many patients as we can if we run out of beds here. if we ran out of beds totally and started looking at hotels, as some other communities have, the best use for those would be for patients who are ready for discharge but can't get to a skilled nursing facility or can't go home or need to be quarantined. It would be very difficult to care for COVID-19 patients outside of a hospital. So the first people moved out of the hospital would be the other patients or the patients who could be discharged. I'll assure you we're going through these scenarios over and over again. Hopefully we won't have to do it, but if we do, we will have thought about it. We won't be perfect. We're going to make some mistakes along the way, but we're doing our best to prepare in the event we need those additional beds.
Thank you. One more question.
If you don't mind, can you speak up just a little bit, please?
Yes, sorry. One more question for you. If it continues to spread a lot, how many testing sites do you see popping up throughout North Alabama, and do you think that you guys will have enough supplies to support those?
Well, I think for the time being, supplies are going to be the limiting factor. We tested close to 600 patients a day when we were running wide open last week. I don't think we were turning people away, so I think we were meeting the demand at 600 patients a day. If we could continue to test 600 patients a day, I think we would be good. I don't know that we would need additional test sites. We may need to look at some test sites for patients who are their immune system's compromised because they're receiving some kind of treatment that you want to get into an area that's away from other patients. I think doing a lot of testing is going to create a lot of positives. When you're doing 600 tests, don't be surprised if our positive tests go up fairly substantially. We're trying to minimize that with all these things. What we hope to do, though, is if a lot of people test positive and a small percentage of those needs hospitalization, that's not necessarily a bad thing, right? Because those people are building up immunity in the community and those types of things. So it's the ones that we really worry about are the ones that need hospital care. That's where the crunch will come if too many people require hospitalization. Yeah.
Thank you.
Mm-hmm.
At this point, we'll conclude this press conference. And again, we will be back Monday. Okay, go ahead. I'm sorry.
Hey, I'm Alex Russell with WH&T. For Mr. Strong, business owners who have had to shut their doors today, do you have any messages for them for, getting them? Are you worried about having to enforce them closing their doors today?
No, I'm not worried about enforcing it. I think everybody sees what's at stake. Again, yes, I worry because I understand. I grew up, my family owned a small business, and understand how critical it is whenever you're not able to meet the needs of the people out there that come to you every day. But the big thing is these next 14 days, if people don't understand how critical it is, just flip on the national TV and take a look at New Orleans and take a look at New York, and you'll understand if you don't sanitize and separate what we could potentially be dealing with here. It's a serious situation. I think everybody understands it. We don't like where we're at. We're not, we're sitting here, you look at David and Jeff and the mayor is here. We don't like this, but the big thing is what we're going to do is give you the best advice we have, the best information we have, not that we have, but what scientists are giving us and what the local healthcare community are giving us, and we're going to give it to the people, and some days it's not comfortable, but yet my heart does go out for the small business owners, and we're going to recover faster than any county or any city in this country, but what we're doing today will lead to that recovery.
Answered my follow-up question as well, so thank you.
All right, at this point, we'll conclude this press conference. Again,